All right, so this is our community improvement group project, and we chose to look at the effects of uncontrolled hypertension in Milwaukee County.
According to the World Health Organization, hypertension is diagnosed when the systolic blood pressure is greater than 140 or when the diastolic blood pressure is greater than 90 when measured on 2 different days. And there's also different stages of hypertension outlined by this chart. Even though hypertension has non-modifiable risks such as family history and advanced age, there are modifiable risks such as diet, physical activity, tobacco and alcohol consumption. And since these risk factors are determined by the patient, education is really important because it can help them make healthy changes. And since these factors are modifiable, education about preventing hypertension is important because the patient has some control over it. And according to the American Heart Association, hypertension poses an increased risk for heart attacks, strokes, vision loss, heart failure, kidney disease, kidney failure, and sexual dysfunction. So hypertension is important and relevant risk here in Wisconsin. According to the Wisconsin Department of Health Services, 1.3 million adults in Wisconsin have hypertension, and less than half of it have it under control. And further, 40% of them are unaware that they even have hypertension. And additionally, only 3 out of 4 patients take their antihypertensive medications as prescribed, which is another reason why education and screening is so important and relevant for the people in this area.
Okay, there we go. So we can consider educating our clients on both primary preventative strategies as well as secondary preventative strategies. For primary prevention, we need to be educating our clients on things like eating a healthy diet, reducing salt intake, and reducing how much fast food we eat, and as well as incorporating more exercise into our routine, limiting alcohol and tobacco, and so forth. When considering secondary prevention, this is looking at getting our clients into the screening clinic to be seen and have their blood pressure taken, as well as we can emphasize the importance of seeing your primary care provider. So here we're just trying to identify who may or may not have hypertension in this stage of prevention. So in a systematic review by Metlock et al. 2024, they described how the social determinants of health influence health outcomes as they pertain to hypertension, and that people who fall short of more of these factors tend to have a higher prevalence rate of hypertension. So these factors include things like having an education, having a stable and supportive income, stable housing, feelings of safety, having health coverage and support from their healthcare system, and so on. So for the context of our project, we can look at the amount of people in Milwaukee that are not meeting these determinants of health and potentially see a correlation of that population having higher blood pressures. When looking at Milwaukee County and the stress that it puts on the hospital system staff, there are 2 main ideas related to hypertension. As stated earlier, hypertension is related to countless secondary conditions, and these can put additional strain on our already overloaded and spread thin healthcare system. Then, if we were able to manage hypertension before it led to those secondary conditions, subsequently we could be avoiding unnecessary hospitalizations and free up staff for other patients to be seen. So again, as stated earlier, hospital admissions should try to be avoided whenever possible. And in an article by Ashraf 2022, national readmission rates for patients admitted with a hypertensive crisis was 11%. So this is a concerningly high statistic and emphasizes the need for a community-wide intervention. And so when it comes to managing hypertension, it's important that we involve the patient's primary care team. And by doing so, we can regularly have blood pressure being monitored, and providers can assess patient data to identify any concerning trends and provide appropriate education and resources such as medications. Um, as well, this can be supplemented with at-home blood pressure monitoring if patients have the adequate education and materials to do so.
Okay, for our community improvement project, we plan to implement a team of 5 community health nurses under the guidance of one nurse project manager to hold a clinic that provides blood pressure screenings. And this would occur once a month for about a year as we drew it up right now. These community health nurses would screen for hypertension, provide education, and advise follow-up with primary care providers. We also plan to hand out blood pressure cuffs and provide education on self blood pressure monitoring so that people who have hypertension can keep an eye on their blood pressure and assess whether their lifestyle changes are helping, as well as identify if their blood pressure is poorly controlled and further medical intervention is necessary. We would encourage them to keep a record of their blood pressure to share with their primary care provider. So due to the indicated risks that are inherent with chronic uncontrolled hypertension, all residents of Milwaukee County would benefit from primary and secondary interventions to address hypertension. This would ideally help prevent hypertension from occurring in the first place and also identify patients in early stages of hypertension to prevent further complication. Residents of Milwaukee County who already have uncontrolled hypertension are key stakeholders in the resolution of this issue as they face the risk of developing various life-threatening cardiovascular diseases. Milwaukee County residents who are at a disadvantage due to socioeconomic status and other social determinants of health face an increased risk of complications secondary to hypertension. It's the role of the primary care physician and nurses to identify and manage the care of patients who have hypertension. So for that reason, they could be considered stakeholders in this issue. Beyond the PCPs, the healthcare system overall is responsible for treating patients who require intervention to manage their condition acutely. Hospital admissions for hypertension are generally considered avoidable, so this places excess strain on the healthcare system. Like Jake said, in 2022, Ashraf et al. Noted in a retrospective study that the national 30-day readmission rate for patients who were initially admitted for hypertensive crisis was around 11%, and that's statistically high. So avoidable admissions and readmissions put that strain on the healthcare system and create further scarcity of medical resources. And that also places financial burden on both the patient and the hospital. So for that reason, healthcare employees are also stakeholders in this improvement project. It would take a team of qualified healthcare professionals to properly address the issue. For our project, stakeholders would be a nurse project manager and the 5 community health nurses who can perform the screening and provide education. The community health nurses would provide education about the modifiable risk factors that Nick outlined, as well as some lifestyle modification to reduce hypertension and education on self-monitoring.
Our nurse-led initiatives that focus on education, screening, and follow-up can just make a big difference in controlling blood pressure around the Milwaukee County area. Like Michael said, community members are expected to benefit the most. With better access to education and regular screening, people are just going to feel a lot more empowered to take control of their health. And that empowerment leads to better lifestyle choices, stronger self-management, and fewer long-term complications. So for us, the hospital can benefit from that public seeing the hospital more positively due to this enhanced relationship with the community, and that can provide a return on our investment. These initiatives can reduce ER visits and prevent readmissions from things like, hypertensive crises and strokes. And so that takes the pressure off of, the already stretched thin hospital resources. Um, it also ties into performance-based reimbursements. So fewer readmissions and better chronic disease management can translate to financial gains for us at the hospital. Staff satisfaction is also another bonus with this. When nurses see that their work in the community is making a difference, it can boost morale and it can even help with nurse retention. And there again, less turnover means we're spending less dollars on the hospital side. And so there's another financial upside to this project. Like I mentioned earlier, by strengthening relationships with the communities we serve, hospitals can build a trust, especially in those underserved areas, while promoting a focus on prevention, and it just helps everyone in the long run. Overall, I think this project will positively impact all stakeholders and it will have a positive return on our investment. So as we see, this just gives you a little outline of the budget, but I'll talk about that a little bit more in depth. So we're planning, this would be for the first year. We have a project manager that will cost us $66,000. And then our 5 nurses, our 5 community health nurses altogether will be $270,000. Mobile blood pressure screening events will be $3,090. A van rental will be $12,000. Free home blood pressure monitors for patients will be $20,000. Posters and flyers for the community will be $800. So that project total would be 371,890. But if we are able to secure the Greater Milwaukee Foundation grant, that would take off $50,000, making our total $321,890. And I think we could make a pretty good, we could have a good shot at getting that because this grant is open to those seeking funds for a lot of different reasons, but a few of the bullet points they laid out are building solidarity and collaboration among service providers and the community they serve, addressing the health impacts of racial inequity, particularly health interventions that are disproportionately underfunded, advancing an integrative approach to well-being, increasing access to culturally relevant and affordable healthcare, and delivering health-led interventions that meet care needs not traditionally covered by insurance and/or are in locations with inadequate access. So I think we'd have a great shot at getting that grant. All right, so for our resolution, we're just overall trying to get Milwaukee County healthier through early identification in at-risk patients. And obviously that's going to lead to increased patient satisfaction, decreased stress on the healthcare system, decreased hospital readmissions, through education and empowerment. And overall, I strongly believe, and we strongly believe, that this project could help tackle that issue, and we think it would be a very powerful intervention and project to get going in the community.